My name is Aziwoh and I'm a student nurse, and I'm just here to demonstrate wound change. So first of all, before I begin, I'll first of all check on my patient's chart to see when the previous dressing was and if my patient has taken any medication. In this case, my patient has taken his pain medication and it's no pain. I'm going to go ahead and cover this blindfold privacy while I move to my work area. Already I have my equipment set up, and so I'm going to do some hand hygiene while I identify the patient with the first and last name and date of birth. In this case, the patient's name is Bedford, and he was born in September 9th of 2022. And then I am going to put on my gloves.
Now with removing the dressing, I want to do the push-pull method. And if at any time it's sticking to the skin, the bandage or the tape, I can use almost a knee to release it so I don't hurt the patient.
I'm then going to raise the bed to a comfortable working condition. I'm going to bring it up to waist level. Okay, this is good. And then I'm going to put down the veil of the yellow.
And then if there's an odor, I'm going to take it.
Then I'm going to uncover the patient and expose the surgical wound.
Is it approximated or is it deficient? In this case, it is approximated. It is closed. What type of
So I'm also going to check and pull aside if there is any drainage tube, and also if there is any connected to the patient. I'm going to pull that aside and expose the wound. Next, I'm going to take off the old bandage using the push and pull method. And I'm going to do that in the direction of the hair. And if there is any adhesion, I'm going to use saline. Then I'm going to assess the dressing, the old dressing, to see, and I'm looking for presence, I'm looking for amount, I'm looking for the type, I'm also looking for color and odor. In this case, there is nothing, so I'm just going to drop this, which is pretty good. And then I'm also going to assess the wound, and I'm looking for a linear, and I'm also looking at the number of stitches, if they're all in place. In this case, we have 6 stitches, and there is no dehiscence, and also no edema. And it all looks good, so I'm going to proceed with my new dressing. But before doing that, I'm going to take off my old gloves. And I'm also going to perform some hand hygiene. Next, before putting on my sterile gloves, I'm going to prepare my sterile field. And first of all, I'll take the sterile drape, and I'm going to open it away from me and drop it 6 inches above. Then I'm going to make sure I pick not to touch the sterile side. I'm going to hold the edges with 1 inch. And then I'm also going to take my gauze sponges, putting it away from me, 6 inches, and I'm going to drop it on sterile field. And then my abdominal pad, dressing away from me.
And then you kind of put your hand behind the cup.
Drop it. Then I'm going to wear my sterile gloves. I'm just going to take a step back and to make sure not to back my sterile field. Before putting on my sterile gloves, I'm going to put my tape, and I'm going to make sure there are 5 different tapes.
Then I grab the abdomen band, and I have the blue line facing up towards me, and place it above. And now I would tape the surrounding.
And the fit tape, I'm going to have my initials, the date and the time written on it.
And then I place the date and time sticker on top. And then once done, I can recover him.
I'm going to perform some more hand hygiene.
And now I'm going to remove my PPE by pinching and pulling.
And then now I can put on my sterile gloves.
And then putting hands, 2 fingers under. And in this case, I'm just not going to throw it away because I have to use it for later on. And then goggles. And now I'm going to remove my gown. Away from me. I'm rolling. I'll let you check my first. Now we throw that away. And then I'm going to do my next.
With my sterile gloves on, I'm going to pick up the gauze. And I'm going to place it on the surgical wound. Then I'm going to pick up the abdominal pad, making sure that the blue line is at the top. Then I'm going to tape the 4 sides.
Lower the bed, making sure the legs are up, make sure that it's comfortable, having a note that the collar's in reach and that the side cable is covering them. And any supplies that I left in the room, I would take with me when I leave. And then I would check the wound once it shuts and maybe more frequently depending on the wound and how frequently and how fast.
And my last tape, I'm just going to put it over. Now I've break the sterile field, so I can then go ahead and pull down the patient's gown, make the patient comfortable, and then I can now raise the rails. Then I can then lower the bed, so comfortable.
I'll just keep my oh, you're dressing? Yeah.
Lowering the bed and lowering the bed. All right, then I'm going to tell my patient that we will be coming back maybe in 30 minutes, in an hour, to check on the wound and also to administer medication as needed. And then I'm going to then take off my PPE and put the patient's call button really close by if they're in need of anything. Thank you.